You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting dentures. No more dentures. With us, we have an expert on the topic, Dr. Art Mirelez. Dr. Mirelez, welcome to the program.
Thank you for having me. Glad to be here.
Now, I know you brought a lot of photos. We'll try to get to as many of those as possible.
Okay.
And we're talking about dental implants. But first, for people that don't know your practice, who's a typical patient and what are the different services you offer?
Well, we have a general practice, which means that we provide services from teeth cleanings all the way to bleaching, to veneers, to implants. And we have patients that are of all ages 3 and up. And one thing that's really exciting to me is this whole new world of dentistry called dental implants, because I really feel that that's where we can make the biggest impact on patients' lives.
You said no more dentures, or actually I said no more dentures.
Yes.
So you don't believe anybody should be wearing a traditional denture because they're not attached to anything, you say?
Yeah, you know, today, Randy, dentures are so archaic, and it's for those individuals and people that don't know that there's other options available to them. And with what we can do for the patients' lives today has such a profound impact on the quality of their life. And I think that's the biggest difference when it comes to somebody with a denture versus somebody that has implants that are holding on to those teeth, is the quality of life that they experience. I get patients all the time telling me that, wow, I wish I would have known about this 25 years ago. Honest to God, I have not had one patient that has regretted getting dental implants. Not one.
So you say, and we've talked on the telephone, that people can, you know, the day of the procedure,
Yes.
they can walk in without teeth and walk out with a fixed set of teeth that don't come in and out.
Yeah.
Is that right?
That's absolutely right. With today's technology and with the systems that we have in our office, it's absolutely amazing that we can have a patient walk in with very, very poor teeth, meaning that they're not fixable, and walk out with teeth that are attached to implants. Not one person will know that they're fake, but myself and the patient. That's my goal. My goal is for them to walk around and not anyone to know that they're fake, with the exception of me and my patient.
And they could eat whatever they want, or they have to be careful?
Yeah, I mean, for the first few weeks or so, you got to be careful, right? I mean, you're going to be a little sore, which is normal, but after that, yeah, I get patients that are saying they're eating corn, they're eating apples, they're eating steak, they're eating, you know, I had a patient who bit, I have a photo, I think, of him. He bit into a rib and the teeth, you know, chipped. That's how hard he was biting with these new teeth, you know. With the denture, he was never able to do that. So it chipped because, I mean, it takes a lot of strength to chip some of these teeth, but that's how hard. And he said, you know what, I was kind of happy that I was actually able to chip something as a result of biting into something I have never been able to eat before. Let me show you, Randy. I have a patient here where he was in such bad shape, he was not able to eat, so those teeth had to go. So we gave him his options. His options were to remove his teeth, give him a old school denture, take his teeth out, place implants, and walk out with a beautiful smile. At that point in time, he wasn't ready for the implants, so he decided to just take his teeth out and give him a denture. So we did that. It was a gorgeous looking denture, but just functionally, he couldn't eat, he couldn't chew, he couldn't, you know, speak properly. So a month goes by. I knew he was going to come back. I hate to admit it, but I knew he was going to come back. He comes back and he says, I'm ready for that. I'm ready for those implants. Let's move forward. So he came in one day. We placed 5 implants. We attached the teeth to the implants. He walked out with a beautiful smile. Now,
like a full arch of teeth?
A full arch
of teeth. On just 5 implants?
On 5 implants. Yeah, with today's dentistry, we don't have to place 1 implant per tooth. So now he has a full arch of teeth. He can eat anything he wants. Better yet, he speaks properly. He can go out to in public without having to take his teeth out. Actually, this reminds me, let me tell you a story.
All right.
As I'm meeting these patients at their consultation, I'm learning so much more about these implant patients, potential implant patients. This patient comes in and she has an upper and a lower denture and she hates it. She's about 70 years old and I always really would like to know why they hate it, to make sure that I provide them options that can basically provide them solutions to the problems that they have. So she says, you know, Dr. Mirelez, I really hate when I have to go out in public and I have to think about what I'm wearing. And it's not jiving, I'm not understanding. She's like, I have to make sure that I wear pants that have pockets in them. And I said, what do you mean? She's like, well, when I go to dinner and I have to talk with people, I have to make sure that I have somewhere I can place my dentures in while I'm eating or while I'm chewing with these, because I can't chew with these teeth.
Wow.
So she has to customize her attire to the location that she's going because of her teeth. So she says, I take my teeth out and I put them in my pocket. And so for me, I was just like, wow, how many people out there have stories like this that they actually have to think about?
Is that common though? Really?
You know what? It is more common than you think. People are typically, that have dentures, are not going to go around complaining and telling everybody that they hate their dentures or they hate their teeth. You know, it's a dirty secret. It really is. You know, I have a lot of patients who tell me that their significant other has to step out of the room if I'm going to take their teeth out, because their significant other who's been married to them for 40, 50 years has never seen them without teeth.
Is that right?
Oh yeah, it's amazing. So this lady now, she wanted to have teeth that were non-removable. She didn't want to have to go through those embarrassing moments anytime. So she came in, and at this point in time, she was only able to do the lower, which is the one that most patients have the problems with, is their lower denture. And by the way, the reason people have problems with their lower denture compared to the top is because every time that tongue moves, that denture moves around. On the top, you have a suction like a vacuum, and so it's a little bit more stable.
Okay.
But a lot of our patients are walking around with just an upper denture and not a lower. So she says, you know what, let's start with the lower. So we did. So we placed 5 implants on her lower arch, and we attached a full set of teeth on those 5 implants. And now she's not walking around in pants, she's walking around in dresses.
Okay, so these are permanent teeth.
These are permanent teeth.
And they can eat whatever the heck they want,
They
right?
can eat anything they want, exactly. I mean, once they're attached, I mean, those teeth are stronger than some of our teeth, to be honest with you.
Now, there are 2 types of patients. We talked on the telephone. People trying to avoid dentures and people already wearing dentures. Are there a lot of people where you are in Fresno that are wearing dentures?
You know, believe it or not, the studies show that there's over 40 million people in the U.S. that wear dentures. That's almost equivalent to the population of Canada, if you think about that. And so in Fresno, there is thousands. I would say there's probably 40 to 50,000 people walking around
Is that
with
right?
Oh yeah, with dentures.
Then
definitely.
if locking, you know, a denture in or whatever on dental implants is so good, why aren't they all doing it? What's your take on that?
You know, it's been my experience that a lot of the people that come in, they don't know what their options are. Or, you know, the studies show that the average denture patient goes to visit their dentist every 16 years. Think about that, Randy.
So they don't go to the dentist.
They don't go to the
nobody's
dentist.
offering
Yeah,
them...
they don't go to the dentist. They go to the dentist when a tooth chips, or if they have a sore spot, and they're there seeing us for relines or repairs, because we also have a lab inside of our office, and so as a result, we can fix things really quickly. But that's sometimes the first time where I'm explaining that there's some alternative, there's some options that they weren't aware of. I have other patients that have been told by other dentists that they're not candidates for implants because they don't have enough bone, or because they're too old, or quite honestly, maybe the dentist doesn't have the experience of how to fix these patients' teeth. So there's many reasons why people are not aware of this. And I'm here to say that, listen, today's dentistry, it's very successful. We can change people's lives in a day. I always tell people, change your smile, change your life. Because I really feel that. If you can change somebody's smile, that has a profound impact on how they carry themselves, the confidence that they bring. I had a patient just recently who we extracted her upper and lower teeth. They were all failing, meaning that we couldn't repair them anymore. So she came in just last week, and she tells me, you know, Dr. Mirelez, I'm so thankful. I'm a little sore right now because it's only been 2 weeks, but she's like, I'm so thankful for this because now people want to talk to me. And I said, well, what do you mean? She said, well, I used to go to my friend's house, and this friend has lots of friends. And so she's constantly meeting new people. And so she says, in the past, you know, people would just say, hi, nice to meet you, and they would walk away. And she says, now they sit down and they talk to me.
Because what? She's smiling more?
Because
more approachable?
Because she's more approachable, right? I mean, unfortunately, we live in a society that stereotypes people, and as a result, that stereotype typically comes from the number one feature in a patient's face, and is their teeth. So think about it, right? How many people have you seen on the street that have missing teeth? What do you think about those people, right?
Yeah.
right? So
Like they're poor or
they're
not educated
poor,
or
they're not
whatever.
educated, but there's no truth to that. There's absolutely, everybody has a story, right? In my practice, I really want to learn what people's stories are. So this patient's story was that, hey, I was so embarrassed, I didn't have the confidence to talk to people. That was one thing. But then also people were not engaged or wanting to talk to me because they perceived me as something that I wasn't. And so here we have a patient who, she was more appreciative of the fact that now she can go to this friend's house who has a lot of new guests coming in and out of their house, and people are sitting down and talking to her for the first time. So
They hug you. You said patients hug you. Like they're
Yeah.
compelled. They want to hug you.
yeah, you know, and I'll tell you, there's nothing in dentistry that is more fulfilling than doing implants. I can clean people's teeth, I can bleach people's teeth, and I typically will not get hugs and tears from that. Now, when I give people a whole new set of teeth and I attach teeth to them, and their smile is radiant, their whole self-character just changes overnight, literally, I think they appreciate that a lot more. I get patients that wake up, because we sedate our patients, and I give them the mirror, and tears come out of their eyes, Randy.
Really?
Tears, yes. And so for me, a lot of what I do, and the reason I'm passionate about it, is because it's the only thing in dentistry that I feel we can have a profound impact on patients' life.
So nobody should be wearing a denture.
Nobody should be wearing a denture. Nobody. In
A
fact,
loose-fitting
you know,
denture.
I think I have a picture, Randy, of somebody that was so grateful. I had to capture this picture. So let me tell you about her, Randy. So this patient, she had some treatment done in the Philippines. She's a nurse, and so she's constantly in the public's eye. I mean, she's dealing with patients on a daily basis, and she just could not smile. Could not eat. She could not chew. So with her, Randy, we had to take all her upper teeth out because half of those teeth were bridges that were failing. On her lower teeth, actually, those were good teeth. They were just not in the right position. So we actually put braces on the bottom teeth. So with a lot of these patients, we don't have to take everybody's teeth out. I'm a firm believer if you have a God-given tooth that's healthy and is stable, we're going to hold on to it. Now, but here's her after. Look at her smile, Randy. I mean,
Very
that's
nice.
just absolutely life-changing right there. Look at that gorgeous smile. It follows the lip line. She's showing more teeth. She doesn't have that reverse smile. Her teeth are in line with her lower lips. Who's not going to smile more often with that smile?
Yeah.
Right? Look at her before. Right? Her
Yeah.
before, I mean, there's just no confidence in that face. She's trying everything she can to smile right there. I mean, I'm telling her, please smile. Like, give
So
me
that's
the
her
big-
smile.
That's her smile. So if you look at the upper teeth, her new restored teeth,
The difference.
it's a profound difference. I mean, she's smiling with confidence. She is coming in the office. Every time she comes in fact, she gives me a hug. I had to show you this picture.
She's hugging you, right.
She's hugging me. I mean,
Yeah.
there you go. I mean, she is so appreciative of what me and my team have done for her that she's not afraid to show it with thank you cards, with words of compliments, and a hug. You know, so if I can get a hug,
So she could eat, chew, whatever she wants.
she can eat and chew anything she wants. There's no limitations.
So she would have been wearing dentures maybe if she didn't go to you.
Yes, for sure.
Right?
For sure. A denture that covers her palate, which covers her taste buds.
So does it cost more though to go to somebody like you that has the training or the experience?
No. I mean, the short answer is no. Whether you go to somebody that has only done one implant in their career, or you go see me, who have done thousands, the price is
Because you got to start somewhere, obviously.
You have to start somewhere, you know. And I think that's one thing I encourage our patients to think about is know the person that you're seeing and their experience.
But isn't it true that if you've been wearing a denture for, let's say, 30 years,
Yes.
that you don't have enough bone, that the bone dissolves away, that you can't do this?
That's not true, Randy. With today's techniques, with today's technology, one of the first things we do is we get a CT scan. In our office, we always get a CT scan. It allows us to look at the bone, look at the quality of the bone and the amount of bone before we even perform the surgery. So in our office, we have a guided surgery system, which makes the entire case more safe, more predictable, and less painful for our patients. I mean, it's amazing what we can do today.
I know you don't like bragging about yourself, but you pioneered this guided medical device.
Yes.
Is that right? That basically is a guide, goes in the mouth,
Right.
low down time for the patient to get the dental implants. What about pain though? Because it does seem painful.
We use sedation in our office, so during the procedure, there's no pain whatsoever. After, you know, patients will take Tylenol for a couple days, if that, little soreness, but if you ask any one of those patients, is it worth what they went through? Every single one of them will say, I wish I could have done this a long time ago.
Are there some patients that say it was not painful at all?
I've had many patients who say, I took one Tylenol because you told me to, and I was fine after that. In fact, when I always call my patients the day after to see how they're doing, and they'll say, I know you gave me this bottle of pain medications. Do I got to take them all? Because I really don't feel like I need to.
All right.
And I say, no, if you're not feeling any pain, then just continue on.
How old can you be? So if you're wearing a denture, somebody's watching this, they're
Yes.
wearing a denture, or their teeth are failing, like you said, they're ready to come out. How old can you be to get this done?
You can be any age as long as you feel like you're worth it. Honestly, I feel a lot of people in our practice think they're too old. In fact, I have a patient my oldest patient is 91 years old. 91 years old. In fact, I brought a photo of him.
Okay.
So here's my oldest patient, 91 years old.
Are they more likely to fall out though if you're 91 years old?
No, not at all. Not at
So
all. You can be
statistically
showing if you're 20 years old or 90 years old, the success rate is the same. It really comes down to...
Do you have like 80-year-olds, which is young today, that go in, had a denture, and now they're in fixed set of teeth walking around?
All the time, Randy. I mean, we have a lot of those patients. I mean, today's average age is 86 years old of life. So if you're 60 years old, you still got a long way to live, and quality of life is really important to these patients, and that's why they invest in doing these type of treatments for themselves.
Okay, you brought photos, and we
Yes,
are
I
short
did.
on time. Why don't you show me some of these?
Okay. So here we have a patient from
my
my
goodness.
church. Yeah, it's pretty bad. She couldn't eat, needless to say, bleeding gums, toothaches, abscess. I mean, the list goes on and on and on. And she just needed some help. So she didn't want a denture. So I said, I can help you. Look at her face right there, Randy. She's really trying to smile, and she just can't, right?
Okay.
So here's her after. We fixed her up in one day.
Wow.
Upper and lower teeth in one day. She's a whole new person again.
Are those, now, is this a snap-in,
So
snap-out
these,
set of teeth?
yes. So what we did is we took her teeth out, we placed implants that same day, and we attached her teeth that same day, all in one day. Absolutely amazing what we can do for these patients.
She looks great.
Oh, she's on top of the world. She's smiling from ear to ear. Look at the difference in her smile on the before and the after.
Yeah, yeah.
How one is she's really trying to create a smile, and the other one is just natural, So here's another patient, Randy. He came all the way from Alaska to see us. I mean, look at that. I mean, he didn't have any confidence to smile. He was really ashamed. He had dentistry done over and over
How
and
does
over
he find
again.
you from Alaska?
Through our website, Randy.
All right.
We have patients that find us all the time through our website. They see the type of dentistry that we do and what we can do for them. But he was just fed up with dentistry. This is the typical thing that happens with these patients. They go into their dentist because they have a filling done. After years, the filling fails. They end up getting a root canal. The root canal, for whatever reason, doesn't work. They get a crown. Whatever reason, the crown doesn't work. Next thing you know, we're taking teeth out. So as a patient, why would I want to keep going to the dentist if all I'm doing is spending thousands of dollars and constantly enduring uncomfortable procedures? So now we are able to take these patients' teeth out, place implants that same day, and they walk out with a smile like this.
Very nice.
I mean, he's in progress right now. We've only done the upper. He's already committed to doing the lower because he was so intrigued and so amazed with what we can do and how it actually changed his life. I mean, that has changed his life. Look at the difference in his teeth.
It's changed his entire appearance.
His whole appearance has changed. His whole appearance. I mean, he's smiling from ear to ear. He's chewing and eating with confidence. He doesn't have to think about what social engagements he should go to.
He looks smarter, by the way, in the after.
He does.
Just because of his teeth.
It's
you said that
true.
earlier. I mean, they could look like they're more intelligent, but it's true.
It absolutely does. I mean, when you're missing teeth, people just automatically think that you're not as bright as you should be. And there's no truth to that. He just had bad genetics. Genetics plays a big role in this.
Okay.
Genes.
Now, you're showing me a lot of photos, though, of
Yeah.
pretty disastrous mouths, right? This has got to be unusual.
It is not unusual. I mean, these people are all over town. I guarantee you that somebody today that's watching this knows somebody that is walking around with either a denture or teeth that are just in really bad condition. And these people are everywhere. You don't see it. I don't see it. And the reason is a lot of these people smile like this.
But they just don't smile.
Or they grow a big mustache. They just don't smile.
But if your gums are bad, right? A lot of these people, bad gums.
Right,
How
right.
could you get implants if your gums are bad?
What we're seeing today is if you take all of their teeth out, a lot of these gum disease processes go away once you place the implants.
Okay.
So if bad gums is the issue, then you can take those teeth out, place dental implants, and have beautiful attached teeth for the rest of your life. So it's pretty remarkable what we can do. Let me show you another patient,
All right,
Randy. This is a nurse that came to us, and she was just fed up. She was tired of these dentists making claims that they can help her, so she had teeth fixed over and over and over again. She was self-diagnosing herself. She was basically saying, I need to take these teeth out. That's how fed up. Where other dentists were maybe telling her, we can fix these teeth. So she came in, and I mean, look at her smile. She's really holding back.
So you could not save those teeth?
We could not save these teeth. I mean, the upper teeth, they had to go. And here is her after. I mean, she's a whole new person. She
Wow.
is smiling from ear to ear. Look at her teeth, the way they line up with her face, right? There's no spaces there. They're absolutely gorgeous. She comes in, and she's another patient that has always given us hugs, and I appreciate those hugs.
Backing up for a moment about denture wearers. Okay, so if a denture wearer walks in your office,
Yeah.
what are their options when it comes to dental implants?
So we have several options in our office. One is you can place 2 to 4 implants on the jaw and have teeth that snap in and out. Those patients are going to be much, much more comfortable than a patient that has a denture, for sure. These are removable options.
They can eat and chew.
They can eat and they can chew, but they do come in and out. Now, we do provide a better option, which you would just place maybe 1 to 3 more implants, and those are non-removable teeth, where we can place the implants that same day, attach the teeth to them that same day.
Like a full arch of teeth.
A full arch of teeth. All the teeth are attached to these 5 to 8 implants, regardless of how many implants you're using. We can definitely attach those teeth to them, and they walk out with teeth that cannot be taken out, with the exception of me taking those out.
Are they ever skeptical, by the way? They say, doctor, are you sure?
You know what? When they are, I give them my other patients' phone numbers, and I encourage them to call them and ask them all the questions that they want about the treatment that we provided for them. So that's usually not an issue in our practice.
We have time for one more photo.
All right.
I know you wanted to show all the photos.
Let me show you this patient, Randy. I'm really excited about this. This patient, he came, his teeth were falling out over and over again, literally falling out to the point where his teeth were so loose he can remove them himself. So he wanted a set of teeth that snapped in and snapped out. And so we gave it to him. So we removed his upper teeth and his lower teeth, and we gave him some snap-on teeth. The teeth snapped onto his implants, and there he is. He's eating and chewing whatever he wishes. I mean, just...
Very nice.
Yeah.
Now, people need to know, if they're just tuning in, I'm not siding with you, right? I'm not endorsing you. This is a real interview, but the way it's normally done is patients may go to one surgeon that does the surgery for the implant. Then they go maybe to an imaging center, and then they go to another doctor that puts the tooth on top.
Right.
You do it all right there. That means your center, everything's done right under one roof.
Yes, at our center...
Aside from convenience.
Well,
What's
convenience
good
is a
about it?
huge issue
Okay.
when it comes to patients, because I get a lot of patients who say that they've visited 3 to 4 dentists and they still haven't even started treatment because they're so confused. This dentist wants to do something, this dentist wants to do something, and then they start adding it all up and they don't know where to start. So at our office, I tell them that, look, you're going to come to this office and I'm treating you from A to Z, and then we're going to maintain you after that point for the rest of your life. Because in our office, we have a CT machine, I have an in-office dental lab, I do the surgery, and I restore the teeth, which means that I create the beautiful smile and I attach the teeth.
So that's
to
how
the
you're able to
implants.
do it same day.
Same day, all in my office, all with me, my team, which are my clinical partners. I'm the only dentist that does the implants, but I have a phenomenal team, Randy, that make everybody come, that walks through the door.
Everybody on my show says that.
Oh.
But we
listen.
talked on the phone, and you convinced me that actually yours is really like this happy place. You say people don't like going to the dentist, but they like going to your place.
I can prove it. Check out our Facebook, and you can see some of the random photos that we post. And we just have a really, really fun time at our practice.
So don't be afraid. We're out of time.
Yeah.
So if you're afraid, or you think you're too old, or you think your gums are too bad, you're still a candidate most of the time for dental implants.
There is still help, and I would encourage you to come to our practice, see what your options are, let us make a difference in your life. That it's an investment. It's an investment that's going to give you a lot of good memories for the rest of your life.
But you're a dentist. You think the smile's pretty important.
Oh, yes, without a doubt, Randy. I mean, think about it. If you're going to a job interview and you're missing some teeth, how does that make you feel? at that job interview?
You probably don't smile.
You probably don't smile, right? Now, if I'm interviewing you and you have a radiant smile, and I have another person I'm also interviewing, and they're missing some teeth, who am I going to hire?
At least the one smiling.
At least the one smiling. And the reason is that person usually is more confident, right? They are perceived as somebody that is competent, that is intelligent, that is going to help them improve their life.
But for the denture work, because you say there's a lot of people that don't like the look of their denture.
Right.
I could spot a denture walking down the street.
Right.
On these that you're attaching with dental implants, do they look like, I mean, they look like real teeth?
They look like real teeth. And what it comes down to is I'm the architect of the smile. I'm going to design a smile for my patients that looks natural. Nobody should be able to tell that they're false teeth except for me when I'm doing my exam, and them because they have to maintain them. But as a result, there should not be any patient out there, if it's done properly, where you can pinpoint that's a fake tooth, that's a real tooth. They should all blend in very naturally with their face.
Now in your center, they could see you.
They can
could
see me.
actually call and say, I want to speak to Dr. Mirelez.
Anytime. Yep.
Okay, good.
Give me a call.
I want to thank you for coming on the show.
Yeah,
Great
thank you.
stuff.
Thank
Great
you.
info.
Let me show one more. Do you mind?
Okay.
Let me show one more, Randy, only because this person here, I know you want to try to get rid of me, but let me just show this guy. So here's another patient, Randy. This is his before photo where we asked him to smile. I mean, believe it or not, this guy is the nicest guy you'll ever meet. But from that photo, could you tell that?
No.
It's hard to tell that. It looks like a mugshot, right? It
Okay.
really looks like a mugshot.
Yeah.
Well, this is why he doesn't smile. I mean, look at his teeth.
All right.
He's had so much dentistry done over and over again. He wanted a permanent solution where he didn't have to continue going to the dentist over and over again. So the teeth had to go. He did not want a denture. That was not an option. He preferred to live with those teeth than to get a denture, believe it or not. And so we fixed his teeth. And here you go, Randy. I mean, this is a whole new person.
Wow.
So now his smile really, really matches his natural personality.
Doesn't even look like the same guy.
It doesn't. It really doesn't.
What'd you do for him? I mean, what is that?
With him, we actually placed 6 implants on the upper, 6 on the lower, and we attached his teeth to it, and that's him today.
So they don't come in and out?
They don't come out. It's a full arch of teeth that are attached to the implants. He can chew anything. He asked me the other day, can I chew this? You know, can I eat steak? I said, yeah, eat whatever you want. Enjoy life, right? You have invested this time and this effort. Go on, continue. There's no questions asked. You do what you want, you know.
So no more dentures?
No more dentures. There's absolutely no need for dentures these days. There really isn't.
And you're the go-to guy in Fresno?
I'd like to think so. Come see me and we can help you out.
All right, I want to thank you for coming on the show.
Thank you very much.
Very good.
Thank you.
You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.